In our current fecal transplant program, which we started about 2 years ago, our main target are those patients who have recurrent Clostridium difficile infection. So this is an infection that sometimes for some patients can become a recurrent problem, that it's not just one episode of infection and then you take treatment for it and then you're done. So it can become a vicious cycle for some of these patients. And so right now we really don't have an effective therapy to replenish all the good bacteria that they are no longer in their system. And so we have to resort to a very primitive therapy, which is fecal transplant. And basically is exactly what it sounds. We have to basically harvest the good bacteria from a healthy individual and then transfer it into a sick patient who no longer have all these good bacteria. And so this treatment has been highly effective. In our experience, it's probably 95% effective. And sometimes these patients, they are really quite sick, and we have had patients who are in the intensive care units. They're not even responding to any antibiotics, and they're just at the verge of needing to have surgery. And then we offer this therapy, and we can actually prevent the surgery. So this is a normal intestine. This is somebody who has a very severe infection with ulcerations and pus in the large intestine. Then we offer them fecal transplant, and then 3 days later, they went from having 10-15 bowel movements a day down to a formed stool. Yeah, so there are different ways that we can administer fecal transplant. So the traditional ways are either by colonoscopy, which means a camera going up your bottom, or we can do it by gastroscopy, which means the camera goes down into your stomach and into your small intestine. Now we are hoping to be able to move away from that because these procedures are quite invasive. And so in the lab, we can manufacture pills which contain the good bacteria that are harvested from a healthy individual. So the idea is that if it works as well as the endoscopic delivery, then hopefully one day this will become sort of the standard care. And we can even ship the pills to remote sites, and so we can treat patients even at their own homes.